My name is Dr. Dionnices Greaves. I am a cardiologist, and besides that, I'm a human being. I am a normal person who loves to spend time with my families and my friends and enjoy the life. Cardiologist is the medical doctor saying that who take care of the heart's health issues. And it is so important because cardiovascular heart disease are the leading cause of death globally, especially in Jamaica. I found interesting to become a cardiologist since I was 11 years old. I had a very bad experience when my grandmother passed away right beside me, and thinking that she should be alive, that she could save her life, made me to trust and to believe that I should be a cardiologist in order to save some other lives. Being a medical doctor, not only a medical doctor, but to be a worker of a medical field is very important because we are being able to help others sometimes in the worst time of their life when they are really sick, not only for the patients but also to the family. It's very important to become part of this grand system or this big system where we have persons who care for others, from the security officer to the person who do the laundry, of course, to the medical doctors. It's very important. It's a humble profession. As a part of our cardiovascular screening, we are going to be doing cardiologist consultations where we can discuss which are your main risk factors, and together with that, or besides with that, we are going to be doing an electrocardiogram. It's very popular, known as an ECG. It's a non-painless test, so you are not going to feel any pain, and we are going to be recording the electrical activity of your heart during the time where you are laying back in bed. It is important because it's going to give us an idea if you are developing any kind of cardiovascular disease or even any arrhythmia that unfortunately we may not be able to discover if an ECG is not performed. This test should be done every year once that you pass 40 years old, or it does not matter if you have any family history of cardiovascular disease, if you suffer from any risk factors such as high blood pressure, diabetes, obesity, or smoking. It is very important for you to test your heart. It does not matter if you are 40 years or more. Okay, so I keep my professional life with my normal lifestyle. It's like a balance. I just try my best to eat properly, to sleep on time, to practice exercise like walking activities whenever I get the chance to do so, and giving the best of me when I'm at work. Being positive means to me everything, because with positive mind and with positive attitude, you could even help the persons even without giving a medication. So being positive, not only from my profession but for life, means everything. When we suffer from chronic illness, means that it's an illness that you are not going to be rid of that in an acute phase. Therefore, you have to be patient, you have to be persistently and consistently with the treatment and with the medical advice. And so you can't just give up. You need to be focused on what the medical recommendations are, so you can just keep moving forward with your illness. It's learning how to live having a chronic illness. Having a patient satisfied with our treatment and with our service means everything, because that means that the patient will always come back and will be accepting whatever decision we made with them, and we also will recommend it. our service to the rest of the person surrounding them. It is very important to have a patient happy, a patient satisfied with what we, with every treatment we give or with every care we give to the patients, because if you have a patient happy means that the rest of the persons who are surrounding the patients are also going to be happy too. And this is what we, at the end of the day, needed from the medical field with our patients.